Good afternoon. Welcome to the daily briefing at St. Clair County EMA office. And before we get started, there's been a lot of talk on our page today about where mitigation was taken, Region 4 was taken out of the mitigation. We went on there and hopefully gave you the answer, not that you want it, but we checked with IDPH and there was an error made. And so we are still under mitigation, Chairman, as you know.
It was an error made by IDPH.
IDPH, wasn't us, not by us, it was IDPH, and we were all excited, we were doing jumping jacks and everything, and
They removed the red line.
everything, in fact, it's up there on the graph that shows, and then they went back and corrected it, but we wanted to let all the team St. Clair, and we appreciate all of yous calling, the phones was ringing, the messages were coming in, and everybody was excited like we were, but so we're still in it. So Sam?
Well, that was not the news that
I called you.
You did, that we were hoping for today. Our numbers are still looking very good today. So as of today, 83,394 St. Clair County residents have been tested, which is an increase of 913 from yesterday. We have 7,153 positive test results, which is an increase of 43 from yesterday. And that does include both males and females from under the age of 10 to their 90s. Our daily county positivity rate today is 4.7%. And we are at 76,241 negative test results with 187 deaths, so no new deaths that we are reporting today. For those who have completed their required IDPH 10-day quarantine, we are at 6,517. For state totals, 5,293,678 have been tested, with 281,371 positive test results, which is an increase of 2,257 from yesterday. And for deaths, the state is reporting 8,538, which is an increase of 30 from yesterday. For hospitalization numbers, and these are for hospitals in St. Clair County, currently, we have 57 individuals that are admitted due to COVID-related reasons, and 5 of them are on ventilators. For regional hospitalization numbers, we have 91 individuals who are admitted due to COVID-related reasons, and 7 of those are on ventilators. For our congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, we are only going to announce any facilities that have had changes, and that is only 1. Integrity Healthcare of Smithton is at 57 cases and 2 deaths, and that is an increase of 13 cases for that facility. And I do want to point out that not all 13 of those happened today. Some of them were for the end of last week. We were just waiting for the facility to get us those results, so they did not have 13 positives in one day. And as a reminder, we still do have some testing left this week. Tomorrow from 8 a.m. to 4 p.m. in Fairview Heights at Moody Park, there will be testing available all day. And I will turn it over to Chairman Kern for his update.
Thanks, Sam. So the only number that really, our county positivity is low, lowest it's probably ever been, but the hospitalizations are up.
They are.
And those two numbers don't seem to fit together.
They don't. Normally when we see our positivity rate go down, we're seeing our hospitalization rate go down too. So it is a little troubling that while we are seeing low positivity rate, we're seeing not only a high number of hospitalizations, but a higher number of those that are on ventilators as well. So we're hoping that starts to even itself out and go back down to how we have seen it in the past.
We're hoping the positivity rate is a leading indicator.
Correct.
So then maybe these numbers go down.
Exactly.
Thanks, Sam. Today I'm wearing my census mask, and this is to remind everyone that filling out your census forms is extremely important. And many people in St. Clair County have not filled out their forms yet. Our state officials, Representative LaToya Greenwood, has been out in force trying to get the community aware that we've got to fill out these census forms. A lot of the funding that St. Clair County receives in its health department, in all departments, including at our highway department, are all based on the census. And so we need to make sure those numbers are as accurate as possible. So be sure to fill your census forms out. At this time, we'll move into our zip code report. In 62203, we go up 2 today to 204. In 62206, we go up 2 to 434. In 62208, we go up 1 to 430. 62220 goes up 3 to 571. 62221 goes up 4 to 671. 62226 goes up 6 to 734. 62239 goes up 3 to 104. 62240 goes up 1 to 34. 62254 goes up 2 to 260. 62258 goes up 1 to 190. 62264 goes up 2 to 100. 62269 goes up 2 to 557. And 62285 goes up 1 to 111. As we heard, the daily county positivity today in St. Clair County, according to the most accurate numbers that you can get, no mistakes made here, we're at 4.7% today. So you can believe that graph when that graph's put up. And our 7-day rolling average is 5.1% today. So that's many days now. I guess, what are we, 7 days below 6.5%, a whole week? It's time that somebody takes a look at that number. Certainly, Team St. Clair, we're proud to be part of you and glad that you're part of the solution to this problem. The state has our regional positivity pegged at 7.1% today. So that is good that the state is bringing our number down, and it's pretty clear that St. Clair County is what's driving that downward trend in the region. So we're going to encourage our neighbors to get to help us a little bit, and we'll get below 6.5%. Bond County today is at 25% positivity. Clinton County is at 8.3% positivity. Madison County is at 8.2% positivity. Monroe calls in today at 6.3% positivity. Randolph is at 1.3 positivity. Thank you, Randolph. St. Clair County is 4.3% according to the state's numbers, and Washington County is 15.6% positive number today. So, Herb, looks like St. Clair County is dragging the region closer to 6.5, but we got to get there.
Well, and we'd get there a lot quicker if we could get some more help. And like I said, it's a team effort. Not only Team St. Clair, but we need the entire region. As we said, many days now, 195 days. We've been preaching that, and if we could just get some two things, we could get a little help from the state and get help from our surrounding counties. I think we could really push this thing a lot quicker. Right now, we're kind of at a snail's pace, and that 7.1 down from 7.3 yesterday. With the help of Brian and Sam and the staff, we're trying to project these numbers 3-4 days out, and we'll see what happens. We can speed it up a little bit. I'll light the fire underneath it, but we'll do it. Back on the census, you talked about the county, but also the municipalities. Each of them receive their funding based on the census, so we need the census counted. That's how the funding. If you want those basic services, we got to have everybody counted. And I appreciate you wearing a mask today.
And the money's going to go somewhere.
Yes.
So we
Might
might
as
as
well come
well
to
bring
us.
as much of it here as we can. The dollars are distributed based upon population. So if that population isn't counted here, someone else is going to will have numbers, and so let's get as much of that money in St. Clair County, the municipalities and the townships, wherever you live. Let's get counted, and we still got time until the end of the month. You have time to fill out your census form.
September 30th is the drop dead date, and hopefully you'll all take advantage of it. And I know we're here for the COVID, but this is important because just as our businesses have been affected by this, the local municipalities, the county government. The finances are really going to be hard this coming year, and so we need to get this done. We need to get this virus behind us, but the only way we do that is all of us being a part of the solution. In Team St. Clair, I tell you, I say it every day, I'm proud to say that, to be a part of Team St. Clair, because when I read the messages and get the phone calls and the staff tells me that, sometimes they're up to 1, 2 o'clock in the morning answering some of those questions, we take each and every one of them serious, and we appreciate that. So please continue to be a supporter of this effort in getting this behind us, because we have to. It's we all got to move forward, and we'll do that as a team. So we'll be back just in a few moments with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back tomorrow afternoon with more good numbers. Thank you.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs, Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
No school, gym closed, don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish, don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and